Hi, everybody. So, given Bruce Willis's recent diagnosis with aphasia, there's been more mention of aphasia in the news than ever, which is really wonderful for those of us who've been trying to inform and educate the public and advocate for those that we know are living with aphasia. However, sometimes the social media and news outlets can provide conflicting or confusing information. So I just wanted to provide some basic information on aphasia and also discuss why memory and cognitive challenges might be associated with a different type of aphasia. So aphasia is typically caused by damage on the left side of the brain from either brain injury or a stroke or a tumor that involves that speech and language center. It is a language disorder, so individuals typically have trouble accessing sounds and words that are necessary for communication. Aphasia affects talking. It can affect understanding what other people say. It can affect reading, and that includes reading comprehension and reading out loud. It affects writing and using numbers. A lot of times, speech and language therapy can help these individuals improve across all of those modalities, but it's not uncommon for there to be some residual impairments to remain. The road to recovery is slow, but with ongoing therapy and support, improvements can certainly be made even years following the brain injury or stroke. Now, a lot of the reports on Bruce Willis have been talking about cognitive decline and memory impairments. So at this time, it appears the origin of Bruce Willis's aphasia is unknown or has not been really mentioned in the tabloids. So I just want to discuss another form of aphasia that's very different from what I just described above. So this is known as primary progressive aphasia. It's also known as PPA, and it's a more neurodegenerative form of the disease. And it's actually a subtype of frontotemporal dementia. So with PPA, language abilities decline over time, and it actually results in a deterioration of the brain tissue that's important for speech and language. So there's no brain injury or stroke when there's a diagnosis of PPA. And with PPA, the initial symptoms are usually difficulties with speech and language. So word finding difficulties, sentence formulation, that sort of thing. However, cognitive problems usually arise later, like memory loss. So there are different types of PPA. There's several different variants, and the patterns of language deficits are usually pretty different from patient to patient. Now, in this case, it still can be very valuable to work with a speech language pathologist when you're diagnosed with PPA, with the goal of really maximizing that communication and providing ongoing support as the disease progresses. If you would like any more information on this topic or related topics, you can visit our resource page where we have some information and several different resources relating to this. Thanks so much.